Ade Abbey fractured multiple bones in an April car accident. His doctor in hospital said he needed surgery, but facing a bill of around $1,200 and no guarantee of a full recovery, he decided to look for something more affordable, a traditional bone setter.
For the hospital,
I was told in hospital that the surgery alone would cost 1.8 million naira, excluding other treatments, but I spent a fraction of that with the traditional bone setter. Moreover, the hospital gave me just a 50% chance of walking and using my hand again, and now I've recorded significant progress.
Using leaves, sticks, ointments, and prayers, Ikande Idoko says he's treated hundreds of patients from home for 26 years and claims no complications.
Why they do come to me is that as we are born into it, I have passion on human being. I don't charge much. So that's number one. Number two, when they come, they're always happy. By the grace of God, I do it as if nothing has happened to their body before. So they always come out perfectly.
With fewer than 2 orthopedic surgeons per 100,000 people, it can be hard to get an appointment. Yet the irony is that while most cases are in rural areas, most of the surgeons are in urban areas. It means that rural Nigerians turn to bone setters like Idoko out of necessity.
Because of it's a highly equipment dependent specialty, you have them only in the urban areas. A lot of these things cannot fit into the rural setting, and because the demand, the need is more in terms of the infrastructure is more in the urban areas. They're actually more in the urban, and the problem why they perceive shortages is because most of the fractures and injuries are in the rural areas.
But from infections to amputations, the risks are all too real. Some health experts want to see reforms and some kind of regulation. Maybe allow these traditional bone setters to treat the less serious cases, with the complex ones going to properly trained surgeons.
They should be part of the referral system. There's no way you can discourage Nigerians completely not to go there. So since that cannot happen, so you might go to the next level and see, are there things that you can shift to them? Or are you going to give them incentives to refer so they get some money from that so that they won't believe that they are completely losing out?
As healthcare becomes more and more unaffordable, even middle-income families say they're avoiding hospitals. Bone setters are a lifeline, but often a very risky one. Experts want to see some kind of compromise, expanded insurance, and more trained surgeons, while giving these skilled bone setters their own place in the system. Kelechi Emekalam, CGTN Abuja, Nigeria.